This is my student support system. Keep watching, keep learning.
Now, lung volume and capacity. First is anatomical dead space. In normal quiet breathing, there is about 15 complete respiratory cycles per minute. The lungs and the air passage are never empty, and as the exchange of gases take place only across the walls of alveolar duct and alveoli, the remaining capacity of respiratory passage is called anatomical dead space, which is approximately 150 ml. Second is tidal volume. What is tidal volume? This is the amount of air passing into and out of the lung during each cycle, and it is about 500 ml in rest or normal breathing. Then there is inspiratory reserve volume. This is the extra volume of air that can be inhaled into the lungs during maximal inspiration. Okay, so after normal aspiration, the extra air that goes in, this is known as inspiratory reserve volume. Now, what is expiratory reserve volume? This is the largest volume of air which can be expelled from the lung during maximal expiration. Inspiration capacity. This is the amount of air that can be inspired with maximum effort. It consists of tidal volume plus inspiratory reserve volume. Functional residual capacity. This is the amount of air remaining in the air passage and alveoli at the end of quiet expiration. The functional residual volume also prevents collapse of alveoli on expiration. Residual volume. This cannot be directly measured by the volume of air remaining in lungs after forced expiration. Vital capacity. This is the maximum volume of air which can be moved into or out of the lungs. Total lung capacity. This is the maximum amount of air the lung can hold. In an adult of average build, it is normally around 6 liter. Total lung capacity represents the sum of vital capacity and residual volume. Now, alveolar ventilation. This is the volume of air that move into and out of the alveoli per minute. It is equal to the total volume minus anatomical dead space multiplied by respiratory rate. Here you can understand this by this diagram. This is a graphical representation of lung volumes and capacity. This is tidal volume. This is inspiratory capacity, which includes tidal volume plus inspiratory reserve volume. Then there is maximal expiration. This is vital capacity starting from here. It includes tidal volume, inspiratory reserve volume and expiratory reserve volume. And this is total lung capacity, which includes vital capacity and residual volume.
My student support system. Keep watching, keep learning.